Liposuction is a great technique because you can address many different body parts depending on the patient. I would say the most common body parts that are addressed are often the abdomen. Patients are looking for sculpting of their tummy without a large surgical scar. Other areas that trouble women frequently are the waist and the hips, the lateral hips, or quote saddlebag area, which some women have trouble with, the inner thighs, as well as in some cases the knees. In men, often the breast can be addressed for male gynecomastia. Also, some patients will have really troublesome areas where the bra hits, for example. They have an extra fold of skin that is unattractive. So it really depends on the patient and the patient's desire. You can use liposuction techniques for any part of the body, including the face, for face lifting or neck rejuvenation, down to the breast for breast reduction, and even for refining techniques for breast reconstruction, in the back and the bra line, the abdomen, hips, thighs, etc. So it's really excellent to address multiple areas, and patient selection is the key, and patient understanding about what we can and what we can't do is also pivotal in our consultation. Combined procedures are very frequent in cosmetic and plastic surgery. Again, we address patient safety. This is the most important thing to us. But liposuction is often combined with other procedures, whether it be with a tummy tuck, whether it be used as an adjunct to a facelift and a neck lift. It can be used in the neck as well. Breast augmentation is also often combined with liposuction of the hips and flanks, for example. And so looking at patient safety and picking the correct operation to combine liposuction with is important, but liposuction can be a great adjunct to other procedures as well. Addressing the abdomen for some patients is really challenging. You have a spectrum of patients who have different amounts of excess skin and different amounts of excess fat in the tummy. We spend a large amount of time evaluating patients specifically if they're discussing their abdomen. There are patients on the easy spectrum where their skin is nice, their skin is tight, they have no excess skin but excess tissue in the tummy that we can address with liposuction alone, and they won't need other procedures. There are women who absolutely need a tummy tuck on the other side of the spectrum, and really trying to match that, the middle patients who may have an indication to do both. Those are the tricky patients that we really try to educate as well. The goal is to have one procedure that is safe, but there are a subset of patients who will need, absolutely from the start, 2 operations, 1 tummy tuck, 1 liposuction to get the best results. And those are the patients we really spend the time educating because of the limitations of both procedures. Liposuction in and of itself cannot help, in the vast majority of patients, cellulite. I tell all my patients who come into Park Meadows Cosmetic Surgery that liposuction is not a treatment for cellulitic changes or cellulite of the legs. It's because it addresses what the cellulite is actually due to. It is due to tight connections between the underlying muscle and the skin. Liposuction usually does not address those connections. You usually have to cut those connections with a special tool. There are certain areas that you can do fat grafting into, and so we have to have a more involved conversation about cellulite and cellulitic changes of the legs and abdomen and flanks before patients think that they're going to be cured of their cellulite because of a liposuction. Indeed, in some patients, it can make it look worse. Stretch marks are totally another question that we frequently get asked, and stretch marks do not go away with liposuction. They can actually reduce the effect of liposuction and really change a good result into one that neither the patient nor the surgeon is really truly satisfied, because it indicates that the skin itself has been damaged before, whether it be from pregnancy, weight loss, or weight gain. And so we do address the stretch marks. However, they will not disappear with liposuction. The results that we expect from a patient really depend on where the patient's starting from and the patient expectations and the techniques used. Our goal is always to expect a decreased volume, a beneficial change in contour of the treated areas. Now, if the patient starts with loose skin with stretch marks, they're never going to develop tight skin that looks like the cover of a magazine. So patient expectation is important to manage in picking the right technique. But we expect a more shapely, a more contoured, a less and removal of volume from those areas. And also we're looking for a smooth contour. However, certainly the most common cause for revision of liposuction, and it's very low, less than 5%, is some waviness or rippling. We tend to see that more when we push the envelope or we try to exceed patient expectations and over-resect, as opposed to staying within the ballpark of what we think is more appropriate. So we expect to see long-term results with a diminution in contour, with a reduction in volume, and smooth contour as well. In choosing the right doctor, it really addresses safety involved with liposuction or any cosmetic procedure. These are by definition unneeded surgeries, and so patient safety is really pivotal here. So I would pick my surgeon or my wife's surgeon or my friend's surgeon based on the same criteria I would use for picking any other doctor. And those are looking at board certifications, which connotes that that surgeon has passed certain stringent quality control measures by their peers. I myself am board certified in plastic surgery and a member of the American Society of Plastic Surgery. And liposuction, body contouring, breast contouring is all integral part of our education in plastic surgery. Also, not only the surgeon, but the location of the surgery is also, I believe, of critical importance. You can choose to be operated on in a closet, in a state surgical center or a licensed ambulatory surgical center, or in a hospital, and those safety measures are different depending on in each location. At Park Meadows Outpatient Surgery, we are a state licensed JCO joint accreditation facility, which meets stringent state regulations as well as some federal regulations, and we were the first licensed surgical facility of any kind in Douglas County approximately 10 years ago. Surgeon qualification, as well as the location, especially liposuction, because it can be done in other areas, in a spa and in other locations. And patient safety, patients should look into the safety records of that facility, as well as the number of procedures that a surgeon does. The more a surgeon does of a certain procedure, the more likely he'll have excellent results, and the more likely, if a suboptimal result occurs, he or she can fix that problem, has seen that complication before, and can end up with a satisfied, healthy patient.